Next, I'll be assessing my patient's neck. I'll be looking at the symmetry of his neck muscles, that I don't see any kind of obvious masses, pulsations, or any jugular distension. I'm going ahead and I'm going to palpate his lymph nodes, and I'm going to make sure that they are soft, that they're movable, that they're not tender or swollen. They're round. I'm going to check his carotid artery, that the pulses are strong and equal on both sides. Next, I'm going to take a look at his trachea. His trachea is midline. I'm going to palpate his thyroid, that it's not enlarged, and that I don't feel any nodules, and that he doesn't have any tenderness. Okay, next I'm going to assess his range of motion of his neck. So if you can put your chin to your chest. Okay, lift up. Okay, right to left. Side to side. Then back. Alright, so I can see that he doesn't have any limited range of motion in his neck. Okay, so if you could resist my hand. Resist my hand. Good. Resist. Resist. Okay, so he has good resistance in his neck. It's strong. Next, I'm going to assess his chest. So, if you could go ahead and breathe for me. Okay, so he has symmetric expansion. I can see that his back and shoulder muscles are symmetrical. Okay. So next I'm going to do tactile fremitus, and basically I'm going to have you say the word 99 every time I move my hand. Okay, so you say 99.
99, 99, 99, 99, 99.
Okay, so if you could angle your back this way, please. Okay, and what I was looking for there is that I wanted to see that the vibrations were symmetrical and that they all felt the same. I'm also going to be looking for any kind of masses or tenderness in his back. Next, I'm going to go ahead and auscultate his breath sounds. If you'll breathe every time I move my stethoscope. Good. Breath sounds are clear. So if you go ahead, I'm gonna have you say the word 99 again every time I move my stethoscope. If you could say that. And this is bronchophony. So go ahead.
99,
Good. And I want to hear that his voice is muffled. If I could hear his voice clearly, that would suggest a density in his tissues, which could be, it could indicate a fluid or a tumor. So that would be concerning or abnormal. All right, so I'm going to go ahead and percuss next.
So if you do the math, what are you doing there?
So with that, I want to hear a low-pitched, clear, hollow sound. And again, hearing a dull sound could be indicative of density in his body, which is abnormal unless it's over an organ, which would be normal to hear that dullness. But we want to hear that hollow, low-pitched sound. All right.
So 1,000.
I'm gonna go ahead and listen to his lung sounds anteriorly. So if you'll turn this way, go ahead and take a breath.
I mean, you set it up right. I mean, several ways you can set it up, but yeah, as long as you just remember you're going to multiply that 60 minutes by the hours, should be good because it's just a lower. So yeah, but I wrote it that way just because you know.
Okay.
Yeah.
So his lung sounds are clear posteriorly and anteriorly, and also bilaterally. Next, I'll be listening to his heart sounds, and I will be paying attention to his heart valve areas. So on a second intercostal space on the right sternal border, I'm going to be looking. I'm going to be looking at his aortic valve. And on the second intercostal space on his left sternal border, I'll be listening to his pulmonic. Down at the fourth intercostal space on his left sternal border, I'll be listening to his tricuspid valve. And then down at the fifth intercostal space on the midclavicular line, I'll be listening to his mitral valve. And there I'd be listening for about a minute for his apical pulse.
Okay, sounds good. I'll work it up.
And then I'd listen here for a minute for his apical pulse.
Yeah.
So his heart sounds strong, rhythmic, and I don't hear any kind of murmurs or swooshing that might indicate anything from regurgitation to pathological issue.